Hi, and welcome to East Meets West, an integrative approach to men's health. I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and we're here to talk about all things men's health. Mike, introduce yourself, buddy.
I am Michael Johnson. I've been practicing acupuncture for 15 years now, and I treat a lot of men's health stuff too. So I'm really excited. Dr. May and I worked together for years, and we have some really awesome and unique approaches to integrative health where we both work from our perspectives to help men who are going through a lot of different issues. So I'm excited about today.
Yeah, me too. This is a subject that I am increasingly seeing more and more of. So I'm excited to kind of dive into it and give you guys some options for treatment. So the topic today is erectile dysfunction. All
Woohoo!
right. Yeah. Yeah. The topic that, most any guy over the age of 40 has some type of stress or issues with and doesn't want to talk about it.
Exactly. I mean, I've seen so many people over the years that by the time I figure out that that's something they want to work on, they've already spent a lot of money and time and haven't even mentioned it because they feel like they can't talk about it. So I'm really
Mm.
excited about having a conversation where people realize this is something you can talk about with doctor you trust or people you trust, and it's not, you're not alone in this. So
Right. Yeah, you're definitely not alone. Let's look at some numbers. So, this was a study back in 2012 that estimated then that it was around the prevalence of erectile dysfunction was around 30 million, and that's
wow.
just in the US. So, that's a substantial number. Now, if we go by ages, 26% of men younger than 40 have erectile dysfunction or some form of it, 40% of men over the age of 40, and then 70% of men at the age of 70 have
Wow.
erectile dysfunction.
That's a
Now, there was
lot
a
of people.
study, yeah, there was a study done that looked at a lot of different countries. So there are 8 different countries. The US was one of those. And guess who had the highest rate of erectile dysfunction? Yep, you're right. Yeah, it's the US. Yeah. Our overall percentage was 22%. So
Wow.
yeah, yeah. So we have a problem, and it's worse here in the U.S. So we'll talk about maybe some theories on why that is. But I'm curious, Mike. So from a Chinese perspective, tell us a little bit about erectile dysfunction and what it kind of means from that perspective.
So they'll look at it from a couple different perspectives. One is if there's not a lot of external components, which I'll get into about, stress, anxiety, that kind of stuff. If it's just, you don't, there's no known cause, you just have erectile dysfunction, then usually it's a kidney issue, which should surprise no one if you listen to this
Right.
podcast
If I had to
at
guess,
all.
that's what I would have went with.
But it actually makes sense because in Chinese
Mm,
medicine, the kidneys aren't just the kidneys, it's also the reproductive system. So
mm,
part of the kidney is the physical, what the kidneys do. And the other part is just the reproductive system and how it works. So basically, if you're not getting enough energy, which as you age, again, this makes sense with your numbers, but as you age, your kidney function goes down, both reproductively and the kidneys themselves in Chinese medicine. So as you age, it's going to become more prevalent because your kidneys get weaker from our perspective. And as you know, and it's a cycle. It's like your kidneys get weaker, the erections are not the same, and then your kidneys continue to get weaker because you're not using it. Now, there are a couple different theories you'll find interesting. One theory is once you lose your kidney jing, is what they call it, your essence. So
mhm.
once you lose that, some of the ancient texts say you never get it back. Period.
Hmm.
It's gone forever. That's it. But a lot of modern people actually disagree with that. They say, well, there's lifestyle stuff, there's herbs, there's medicines, there's things you can do where you can absolutely get some of that back. And I tend to be in that camp because I've seen people who are very elderly and very depleted who still are able to get back a lot of function. So I would be in the more pragmatic, you're not screwed. There's a way to get
Mhm.
back this function, this energy, this essence. And so that's primary, is like, you have a kidney deficiency and boom, You just don't have the same erections. You're going to have other symptoms as well when you have that. You're going to have low back pain. You may have some urinary issues. You may have a lot of fatigue, dry skin, that kind of stuff.
So what does it mean sort of practically to kind of lose your chi?
So they look at it, it's funny. They look at it not just, if you look at the ancient text, they look at, you have a certain amount you're born with. And then based on how you live your life and choices you make, you actually lose that essence. You lose, and you lose it faster based on high stress, bad diet, bad environment, stuff you're exposed to. You can actually lose that faster. And so how you live your life makes a huge difference on how you age. And aging is a big part of the whole essence argument. So, basically when you're younger, if you're taking care of yourself and you're doing all the right things, you're eating right, you're exercising, you're weightlifting, then you're going to lose it a lot less than somebody who's just like, I'm going to drink soda and expose myself to chemicals all day and never exercise, and I'm going to expect everything to work great.
Right. That makes sense. It's kind of, again, we kind of have this conversation each week on the differences here, but we're still kind of saying the same. We're just using different semantics, right? So
Yeah.
the way I explain this to patients is I use the word vitality, right? So it's like we kind of all have a sense of how vital we are at this point in time. And one of the ways I sort of measure that is resiliency to stress. So whatever kind of stress that is, whether it's exercise, good stress, or it's significant emotional stress or whatever it might be. Like resiliency is the ability to take on stress and still function normally. And so it's like I'm saying the same thing you're saying here. We're just using different words to describe it.
Yeah, exactly. And it's funny how that happens every week. Primarily, and vitality is actually a good way to look at essence. It's the same idea. It's the same basic idea. And tied into that are external factors that can affect things. So, stress, anxiety, that kind of stuff are often liver related, which in Chinese medicine, the liver tends to beat up on other organs, including the kidney. It's kind of like the Mike Tyson of the organs that just, when it gets out of control, it just starts knocking other things out.
Yeah. Interesting.
And
Okay.
so anxiety and stress are a big component for this. And not only short term. So let's say you have some anxiety and stress that's short term, and all of a sudden you have some erectile issues. And then all of a sudden you have anxiety about the fact that, oh, I've never had this happen before. That's weird. And the next time you decide that you want to be with your partner, you're like, that comes to mind. You think,
Oh yeah.
This happened last time.
Right. Yeah, and we'll get into that sort of psychogenic, cause of ED in just a bit. Before we get too far down the rabbit hole here, let's talk a little bit about like defining erectile dysfunction, because I think that can be, there are a lot of guys out there like, I still have function. It's just maybe not as good as it used to be, and so I don't really have erectile dysfunction, or what does that even mean? So I'll throw out some symptoms of erectile dysfunction. So think of this as like a spectrum, guys. So it's not like black and white, you have it or you don't have it. It's varying degrees. Okay. So that can include trouble getting an erection, trouble keeping an erection, just reduced sexual desire, so reduced libido, being able to get an erection sometimes, but not every time that you want to have sex, being able to get an erection, but not having it last long enough for sex, and then being unable to get one at any time. So those are kind of the classifications I use currently when I'm talking to my men about like these varying degrees of sort of dysfunction, right? And that's what it is. It's dysfunction. It's not necessarily pathological at this point, although it can be, and it can lead to some pathological issues. But again, think of it as like a spectrum and not a sort of black and white diagnosis.
That's a good way to think about it. And you're right. It's different for every person. I feel like a lot of people I've talked to, they look at it as like, if you can get an erection at all at any time, you don't have it. Like, it's this like, the only people who actually have it are people who are not able to at all, which is not the case.
Yeah. I see this a lot. I have, when in my initial intake, when I see guys, I have a questionnaire that talks all about this and asks various questions. Do you have issues getting an erection, maintaining one, blah blah blah. And a lot of times those answers are no. And then I actually ask them again and start prodding a little bit more. I'm like, well, have you noticed any change in the quality? If you notice that sometimes, it's just not how it used to be or how you want it to be, and almost inevitably the answer is yes. Like, yeah, I have noticed some differences there, or yeah, I wish it could be better. And so those are things we need to know because erectile function is oftentimes a really good gauge for the rest of your health, especially your cardiovascular state. And so having a decent idea of what that looks like gives us a bit of a gauge to determine how healthy you are cardiovascular wise, which is still the number one killer for men.
Yep.
It's cardiovascular disease. So the sooner we can identify that and treat it, the better off you're going to be long term.
Man, that makes sense from our perspective too, because one of the main things the kidney does in our medicine is the kidney and the heart actually work together quite a bit. So
Mm,
if you have kidney dysfunction in Chinese medicine, it's almost always going to at some point relate to the heart.
hmm
Almost
hmm
always. And so it's
Yeah.
interesting that you say that because it's like common.
Yeah. And then there's been some studies on this. The most recent one was in 2018 in a publication called Circulation. And what they did is they followed 1,900 men for 4 years, and they found that those men who had reported some level of erectile dysfunction were twice as likely to experience some type of cardiovascular event, like a heart attack or stroke. And those are just the ones who actually reported ED. So, it's like, yeah, they had twice the risk of those events. So it's pretty substantial.
And that's something that breaks my heart too. Like I feel like it's so frustrating when I see people who are in need and they don't even feel like they're comfortable talking about it because it's such a stigma. And I feel
Right.
like that's something we're doing here with this whole season of our podcast is like I want to eliminate all these stigmas of things you quote unquote aren't allowed to talk about. It's like, you know what, if it's
Mhm.
affecting your health, you should absolutely be able to talk about it with your doctor, with the people you trust in your life. Absolutely.
Absolutely. Doesn't make you less of a man to seek out help, to ask for help, to figure out how to be a healthier man. We don't have to take on the weight of the world and everything else and feel like we have to just take it and not do anything about it. So, good point. All right. Well, let's talk about a few causes. So I'll kind of start with kind of on the Western side here, a few things that I kind of go through when I'm talking with men who seem to have a little bit of ED. So if we can always pinpoint what the root cause is, then it gives us a better chance of actually treating it appropriately. So the
Mhm.
first one is, and the most obvious, and I think the most prevalent, cause is vascular issues. So this is
Mhm.
just problems with blood flow to the penis. Now, this could be due to a lot of different things. It could have to do with atherosclerosis, which is the hardening of the arteries, and that kind of goes back to that published study I just recently talked about. High blood pressure can affect, ED, high cholesterol, diabetes, and obviously like heart disease, like we kind of talked about. But anything that's affecting your vascular system could affect your erectile dysfunction. And oftentimes, like I said, we will first see it there because you have smaller blood vessels there. They're more likely to get occluded first versus larger blood vessels. So if we're seeing signs of occlusion there, it's very likely we're going to see signs of occlusion in other places that have small blood vessels too, like your heart, your kidneys, your eyes. Those are oftentimes some of the first places we'll see like significant, issues with atherosclerosis is in those smaller blood vessel areas. Um, Next is neurological conditions. Now, this is less, but still prevalent. Things like multiple sclerosis, Parkinson's, stroke, spinal cord injuries. Some medications can cause this. Some blood pressure medications can. A lot of antidepressants can.
Oh
Um,
wow.
Yeah, yeah. So if you're on any type of antidepressant and you're having some erectile issues, like talk to your doctor. Like this is something that sometimes could be changed because some have a more profound effect than others. Some of it's dose dependent as well. Um, Two guys, if you're on an antidepressant and you haven't had your testosterone checked, please do that. I can't tell you how many guys I see who are on antidepressants and they've never had their testosterone checked, and they're depressed because they have low T, not because they have depression. You know that where they need an actual antidepressant. So just kind of throwing that out there.
Yeah, and
Um,
that is so important to have that kind of knowledge of exactly what's going on instead of just throwing something randomly at it and hoping it sticks.
Yeah, absolutely. I see this with low T a lot. I just had a young 30, I think he was 32-year-old guy come in, and he had just been to his I think his primary care, and they measured his testosterone and it was low. And so the guy offered him testosterone. And he was like, I don't think this doesn't feel right. And you're right. It shouldn't be. Like if you're 32 years old and you have low T and you're being offered testosterone as first line therapy, you need to turn and run. That's the worst decision, especially if you're thinking about having any kids. That's a terrible idea. And so the first, again, it doesn't tell you once you're on it, you still don't know what the root cause of why you have low T. Like at 32, you shouldn't have low T unless you have some other kind of serious conditions, which again, you need to understand. So don't just jump to testosterone replacement without understanding what the cause is if you can figure that out.
Yeah, and the fact we can actually test for this stuff. Like
Mhm.
this is not something that you have to just guess at. It's like there are
Yeah.
tests for this. There are blood tests you can do to know exactly what's going on. I mean, that's important. And if you root out everything else, let's say you do all the blood tests and everything is great, then that gives you an idea of where you're at. Either way.
Yep. Yeah. Yeah. Exactly. Exactly. All right. Some other medications, ulcer medications, those can sometimes cause some ED as well. There's the psychological factors, like we'd kind of already alluded to: stress, anxiety, depression, lifestyle factors. Smoking really, really has a profound effect. So, guys, if you smoke and you have ED, start there first. I know smoking's a hard thing to quit, but if you want to look at something that affects your vascular system the most, smoking's at the top of the list.
Why is that? Just curious.
Well, just yeah. So it's all about endothelial health. So your endothelium is the inside of your blood vessels, the lining of it. And smoking creates a lot of oxidative stress, which is kind of the same process that happens when metal rusts. It breaks down, right? And so that's through oxidation. That same process happens inside your body. And some things cause a higher level of oxidation than others. Smoking is one of the most oxidative things you can do. So that's why it affects your vascular system, and that's why there's such a huge link between smoking and coronary artery disease, cardiovascular disease in general.
Interesting.
Yeah.
Now, do you
The other
think that
thing is,
that could be why America has a higher prevalence? Is like between the medications and the smoking and other things that just makes it more?
oh yeah, it definitely contributes for sure. Plus, just like poor air quality. So it's not just the cigarette smoking, but it's also, are you living close to factories? If we both lived in Fairbanks, Alaska for a while. Like in the wintertime, you get sucked in, you get that inversion, phenomenon, and it just sucks in all the exhaust fumes from cars and factories and stuff like that. And you're just breathing that junk in all the time. That can still have the same kind of similar effect as smoking would on your lungs and your vascular system. So, yeah, I think it's definitely one of the bigger, contributors to it.
Interesting.
Another one is excessive alcohol use. This one I find is a huge one as well. So guys, especially when we're talking about beer, but any alcohol really, will upregulate an enzyme that's produced by your fat cells. It's called aromatase. Now, what aromatase does, it converts testosterone into estrogen. So the more alcohol you drink, especially beer, then the more of this enzyme you're producing and the more of your testosterone you're going to convert into estrogen. So literally, the more alcohol you drink, the less of a man you become. Literally. So really watch the alcohol intake, and just know there's no safe level of alcohol use. Alcohol you have to think of as like a stress on your system. Now, if you're vital, remember we talked about vitality there in the chi. If you have a lot of vitality and chi, you can take on some stress and still function normally. The problem is if you've got a bunch of other stuff going on, maybe you're pre-diabetic, maybe you have some high blood pressure, maybe you're super stressed, maybe you have some sleep apnea, you're not sleeping well. You've got all these other things that are going on as well. You realize your vitality is not that well, not that good. Then alcohol is going to be an even more robust stress on your system, which is just going to knock you down even more and affect you in a greater way. So think about that next time, because we often use alcohol as a coping mechanism for stress, right? So we feel stressed. We're like, man, I'll just have a little alcohol, a couple of beers or something. And that just kind of relaxes me and helps, mitigate some of the effects of that stress. And, occasionally that may be okay, but not a great long-term solution. It's going to have, the opposite effect than what you're looking for.
I agree, and everybody also has a different idea of what high alcohol use is. So I've talked to
Mhm.
some people who thought like, oh yeah, I just have 4 shots at bed or something, and that's normal, because to them that is normal. But it's like, well, but when we're talking about what we're talking about right now, health wise, it's like it's
Mhm.
going to have serious effects. Or I'll just have a 6 pack of beer a night, and then
Yeah.
I'm fine.
Yeah. Yeah. I'm amazed at what some guys think is normal, like not excessive alcohol use. Like for me, I would even say like, and I've been guilty of this, having 1 to 2 like beers or a cocktail or something a night, but having it consistently like most nights of the week. Man, over after a while, you just feel good. You can definitely feel the effects even at that level. But I'll have some guys come in and they're drinking 3 or 4 drinks a night, and they think that that's not excessive because it's not a full 6 pack, or not drinking during the week and then having like 2 6 packs or half a dozen cocktails or something on the weekend is sufficient. So it's kind of more of the binge drinking on the weekends, and that's not a problem because it's not every night. So again, I think most of us have a pretty decent intuition about what's really too much. I just had this conversation with a guy this week and asking him about his alcohol intake. He's like, yeah, a few drinks here and there. And I was like, well, how do you feel about that? He's like, I feel like it's probably too much. And I was like, well, if you think it's probably too much, it's definitely too much.
Yeah.
You've already figured that out. You just have to accept that, right? And then do something about it.
Yeah, and you're right. It's a terrible self medication. It's like, I mean, I love whiskey. I love a good
Yeah,
whiskey, but
absolutely.
you have to realize like it's all about balance, because you're technically poisoning your body on a micro level every single
Mhm.
time you drink it, and then your liver is having to work to get it out of your system. So
Yep.
you have to realize like, well, if you have poor health, poor vitality, you have liver issues, whatever, kidney issues, then it's going to affect you even more, because you're already having these issues, and now you're putting even more stress on those systems.
Yeah. Well put, man. That's good. Some other lifestyle factors, being overweight. So again, kind of going back to that aromatase enzyme that's in the fat cells. This is a scenario where kind of the fatter you are, the fatter you get. So having some fat mass, produces more of that aromatase, which converts more of testosterone into estrogen. Estrogen is going to make you want to gain fat mass. And so this is kind of one of those kind of perpetuating things that just, gets tough over time. And so this is one of the strategies that we can use is trying to reduce that aromatase enzyme by using various different things we'll get into here in just a little bit. Some not so common things, some chronic health conditions like kidney disease or liver disease, prostate issues, especially if you're taking medication for prostate cancer or other prostate issues, prolonged bicycling. So I
Oh, that's wild.
I see a decent amount of athletes, and especially guys who are doing this for years and years. We can definitely start to see some issues there where they're starting to damage some of the nerves in the genital area, and it can eventually start to affect blood flow there. And then let's see. Oh, the last one that I kind of wanted to leave for last, because I think it's a profound one too, is low testosterone. So low testosterone can actually directly affect your ability to have an erection, just because of how the testosterone interacts with nitric oxide and all that inside your testicles, and the penis as well. And so, if you do have ED and you've never had your testosterone checked, definitely get a check. That's a really great place to start. All right. So as far as
Nice.
causes, Mike, those are kind of the big kind of Western side, things that I always kind of go through. Anything else on your side that you think may
Yeah,
be
you,
good?
you mentioned most of it, but we focus a lot on the stress component, and not just like, oh yeah, I feel stressed, but all the physiological stresses you have in your system, the psychological stresses, anxiety, depression, that sort of thing. It's just that people just don't think about them because, like, well, everybody's going through this. Oh,
Yeah.
everybody, has a hard time in life sometimes. And especially guys, especially a lot of the old school guys I'll meet, or blue collar guys, this is just like, well, it's just part of my life. Like they don't really talk about it because it's just part of their life. So I really try to get to the bottom of that with people of like, well, you're still putting your body's still getting put in this fight or flight, and it doesn't matter. And what's stress to one person may not be to another. I think that's
Yeah.
another big one, is that some people can, like I'm in North Carolina. There's been a massive amount of stress around
Yeah.
huge flooding in Western North Carolina. I didn't have power for 10 days, and couldn't find water, all this stuff. And for some people it's like they're going to have a different reaction than other people. So realizing a lot of it also depends on you and your reaction, and really digging into how your body, how your mind reacts to these things, and then how it affects your health, is a huge thing, because everybody's different, and what's stressful to you might not be to somebody else.
Yeah, great point, man. And what's stressful to you now may be different than what you could take on 5 years ago or 10 years ago.
Oh
So
yeah.
sometimes that's hard to accept. Like, oh, well, I did this, 5 years ago and was able to be fine and stay healthy. Well, things are different now. You're a little older. Your resiliency's down for other reasons. Like you may just not be able to take on the kind of level of stress now that you could 5 years ago. Doesn't mean you can't at some point in the future be able to do that. But at this point, sometimes you just have to accept that and then figure out how to kind of dig yourself out of that hole.
Yeah, and also the fact that everybody has a different breaking point for stress. It's like you get accumulated stress, you'll be fine. I think I'm fine. I think I'm fine. And at some point, it pushes you over the edge. And everybody has that point. It's different for everyone, but everybody has that point.
Yeah, and I'd say guys, we're more likely to push it until we hit that breaking point. And
Yeah.
then, once you hit the breaking point, we need some higher interventional things to try to get you back to normal. Or you may have a heart attack or something. Like, it's something like, I want to say I'm going to mess up on the percentage here, but it's somewhere around 25 to 50% of first heart attacks in men are fatal. So it's
Ugh.
a pretty significant percentage there. And like oftentimes that's to these men that this is the first sign that they realize like there's something wrong. And it's too late for some guys at that point to do anything about it.
Yep. And again, this goes back to like paying attention. If you're having erection issues, paying attention to it, because it could be partially psychological. There could also be something physiological, and you need to figure out exactly what's going on before it gets to the point that you have the widowmaker or something, and you're like, oh,
Yeah.
oops.
Yep, absolutely. All right, let's get into some testing for erectile dysfunction. Like, how do we figure out if a guy has this or not? Okay, so one of the ways, and this is what you're mostly going to do with your primary care, is like looking for underlying causes. So this is where some blood tests come in, urine analysis, hormone testing, all those kind of things, and to try to figure out, what is kind of the root cause here. So looking at your T levels, checking your blood pressure, all that kind of good stuff. Now, once you've kind of gone through that and you're not really seeing any obvious answers, this may be where a referral to a urologist may come in handy. This is where these guys can do ultrasound to actually look at blood flow to the penis to make sure the vascular issues are okay. There's also another test called the nocturnal penile tumescence test. Now, this just looks at like nighttime erections and if you're able to actually have them. This is a really great indicator of erectile function. And this is kind of throw this out there too, guys. Like you should be having somewhere around 3 to 5 nocturnal erections a night. So and you're not going to be able to notice that because you're asleep. But when you first wake up, most days out of the week, you should be waking up with an erection because an erection is what we call a parasympathetic response, which means it's going to happen when your body is relaxed in that sort of rest and digest kind of part of the nervous system, right? So you should wake up if your vascular system is healthy and you're able to have an erection. You should wake up most days with an erection. If you're not, then that's you need to dig into maybe why that is, whether it's you're not sleeping well or you may have a little bit of apnea going on or whatever. Okay.
It's really
Well,
cool.
this test also at the urology, this used to be called the stamp test because what they used to do is they'd put a roll of stamps around the penis depending on your girth and how many stamps you needed. They would put that on there, and then if you broke that throughout the night, we knew that you were having an erection at nighttime. Now they have better testing, things to use now, so the stamps aren't used anymore. But it's funny to kind of know the history of it.
I didn't
Um,
actually know that. That's interesting.
yeah, yeah,
So now a bunch of guys are going to be using stamps, after this
right. Yeah, that's right.
podcast.
That's right. Yeah. And then there is an injection that you can give just to kind of stimulate an erection. We sometimes use this when we're doing PRP, which I'm going to talk about here in just a little bit as well. So that's kind of for the most part that kind of covers most of the tests that we would do for ED. Any comment, Mike, before we jump into
No,
treatment?
and we're going to rely with Chinese medicine. Actually, I work a lot with doctors, so
Mhm.
relying on those tests are good. I'll check the pulse, I'll look at the tongue, but I really like to see when doctors are doing these kind of tests,
Mhm.
and find a doctor who's willing to. I think that's one of the big things is that some doctors are overworked and spend 5 minutes with you and they're not going to run these tests, and so making sure you go to somebody like Dr. May who's actually going to take the time to really get to the bottom of what's going on instead of just throwing some medications at you and hoping for the best.
Yeah, great point, man. Like, guys, be your own advocate. Like, force your doctor to be a good doctor. Like, oftentimes it's not their fault necessarily if they're in a system and they have to see like X amount of patients per day and they just only have so limited time with you. Okay, I get that. That's a failure of our systems, right? But that doesn't mean that you have to accept that. You can kind of hold their feet to the fire and say, I don't want to take this medication until I understand better why this is happening. Let's investigate that more. What does that look like? Okay. And be your best advocate. We're not, in general, guys, we're just not really good at doing this. Women are much better at it. Guys, we're not so much. But you're not going to really find any answers unless you do that. So be your best advocate.
Yep, I mean some of my best patients that for ED were patients who came in with their wives, and their wives are the ones that
Mhm.
brought up like
Yeah.
this is an issue, like let's talk about it, because
Yeah.
he would have never brought it up in the first place.
Absolutely. 100%. Yeah. All right, let's dive into some treatment. So I'll just kind of give you my overview. Obviously, number one is correcting the underlying cause. So I'm not going to throw testosterone or Viagra and all that kind of stuff, at you until we have a better understanding of what the cause is. And that's, stress, what your vascular health is, your testosterone levels, all the stuff that we've been talking about so far. Now, if we have a better sense of, let's say, like, all right, yeah, you do have some vascular health issues, maybe a referral to a cardiologist is warranted to get a better understanding of what that vascular health looks like. We may start with some medications that most of you, I'm sure, are probably familiar with: sildenafil, which is Viagra, or tadalafil, which is Cialis. Now, these inhibit an enzyme called the 5 or phosphodiesterase 5, which allows small blood vessels to dilate. So this will help with an erection if you don't have your arteries aren't too stiff or clogged down there. So sometimes that's a really good sort of test, is to see, are you actually responding to these medications? If you're not, your cardiovascular disease may be more extensive, or your ED may be caused by some other issue, whether it's neurogenic or psychogenic or whatever. And so sometimes, and this is part of medicine, sometimes there's just some trial and error involved. And sometimes we try supplements or medications just to see how you respond to them. And that gives us information that's really valuable as well. On the extreme end, and this is mostly for guys who are, up there in age, more in the 70s and 80s plus, we may have to do some penile injections. Definitely not something that most guys want to do, but if you're dedicated enough and you're really adamant about having good erections, then you can do injections like Trimix, which again is just going to relax the smooth muscle, dilate those arteries in the penis, and get better blood flow. And then P shot. Now, P shot is one that I actually do like doing in younger guys, like when you first start to kind of feel some changes and we understand like what the cause is. Then doing a little bit of PRP into the penis works really well. This is pretty safe and very effective in my experience. This is basically, if you don't know much about PRP, it's platelet-rich plasma. Basically, what we do is we draw your blood and we spin it down a couple of times in this special centrifuge to compact a lot of the growth factors from your platelets. So we get this smaller amount of volume that we then inject into the penis. And it's just the top part into the actual like cavernosum tissue. And it helps to regenerate like tissue there. And that can include some vascular health as well as the tissue space itself. And so we do tend to see sometimes an increase in length. More so, we see an increase in girth and better sensitivity. And so it definitely is a great augmented sort of uh, another treatment, sort, if you will, for ED.
Is it as unpleasant as it sounds, or no?
No, it's not actually bad at all. No, it's I either do a nerve block, so you don't really feel anything, or at least a topical, anesthetic. So it's really not bad at all. I've done it on myself, and it wasn't bad. I did it on myself without any anesthetic or nerve block, just to see what it would be like, and it wasn't bad at all.
Oh wow.
Yeah.
Good to hear. Yeah, and people always think it's funny because acupuncture, you aren't actually needling into the penis for this, but people always think it's going to be this terribly painful experience, and it rarely is.
Yeah. 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 It sounds a lot worse than it really is. It's really not that bad.
Mm-hmm.
Um, some other things too: vacuum devices, and then penile implants. Obviously, those are kind of very end stage kind of things that you want to consider, but those are some tools that you have. Obviously, like the first one, correcting the underlying cause, is where I spend the majority of my time, like focusing.
That's smart. I mean, it's kind of the same thing I do. Is like there's points I can do if it's there's some primary issue. Like I'll have people come in with nerve damage in their low back, or some kind of primary issue that's causing the erectile dysfunction. And there's points I'll do around the sacrum where the nerves come out in your low back there that can be really beneficial.
Mhm.
There's a point under the tailbone that's called long and strong, the English name, and it works. I mean, it's insane that how much
Yeah.
it works. So sorry, helicopter. But yeah, so
Wow.
but yeah,
That's
so that point is amazing. But then a lot of times there's also the component what you talked about, where your sympathetic nervous system, you're under a lot of stress. There's a lot of fight or flight, and there's points I can do. They're going to help the parasympathetic, and so people will notice, like, hey, like
mhm.
this combination worked amazingly because, sometimes there's both. It's not just either or. Sometimes you have both things going on. So
Yeah. Yeah, I absolutely love acupuncture for this kind of scenario, especially guys who come in and they're like, you can tell they're obviously stressed, but they won't admit it, or they haven't been able to really accept it, or even like sense it. Maybe they're just not in tune or connected to their body. You can tell it's obvious, but they're like, no, I'm not stressed. Like acupuncture seems to be like magical for these guys just because it does kind of calm that nervous system down. And then when that happens, all these other things start working better, you know?
yeah, exactly. And a lot of times people won't even realize it. And I'll warn people when I do certain points, like if you get an erection on the table, that can happen. This isn't like,
Mhm.
oh, something went wrong or oh, you need to be embarrassed. Like, no,
Yeah.
we're deliberately working on these things. We're deliberately activating these pathways. So if you
Mhm.
do, you know what? It's normal. It happens. And just not to make a big deal of it because it's not a big deal. It's like I've seen all this before and it's just part of the treatment. And just letting people know that up front is really important because every time you go into a treatment, everybody's like, is this normal? Is that normal? It's like, well, for one thing, there is no normal. It's like some people respond in different ways. But
Mhm.
yes, I've seen this many times before. It's not unusual and it's nothing to worry about.
Yeah. Yeah. Completely agree. Awesome. Well, man, that's about all I have right now. Any other thoughts?
Yeah, so I focus a lot on the acupuncture. There's also some Chinese herbs that can be good. And again, this depends on underlying diagnoses. So, if it's a stress component, if there's like some secondary
Mhm.
stress, anxiety, then there's Chinese herbal formulas like the Free and Easy Wanderer, Xiaoyan, that's great for the stress component. And it's
Mhm.
not something I'm going to prescribe to somebody if that's not what's causing it. If it's more of a nitric oxide issue, which we could talk about in another episode because we don't really have time here,
Mhm.
then Yo Gui and some other herbs there can really be beneficial. But it's all about what is going on underlying. I'm glad you spent a lot of time on that because it's absolutely true. It's like you don't just want to throw stuff at it and see what sticks. It's like you want to see, okay, we have a fairly good idea of what is causing it, and then
Mhm.
honing in the herbs based on that, honing in the acupuncture based on that is going to be essential. And just a success
Yeah.
story, I had somebody come in when I was in Oregon and they didn't want to talk about ED. And finally they brought it up. They had nerve damage in their low back. And then they also had anxiety around not being able to be with their wife. And
Mhm.
both components played. So I did the points in the low back and under the tailbone. I did some stress points in the ears. And the next visit, his wife brought me chocolates and like coffee and just said, whatever you did is a miracle. Like, this is the best anything's been in years. And I don't understand why it works, but it
Yeah.
did. Please keep
Mhm.
doing it. But it's like one of those moments where it's like, you figure out what's going on underlying and then you treat it appropriately, and
Mhm.
look, it works. And when somebody's finally comfortable enough to talk about it. So I think my
Yeah.
final thought would be, have a doctor you trust. And if you don't have a
Mhm.
doctor you trust, then find one you trust. Like,
Mhm.
talk to Dr. May, do a Zoom with him, do a Zoom with me, something, anything to
Yeah.
where you need to feel comfortable. And if you're not comfortable talking about these things with your doctor, then whoever it is, find a different doctor. Find a doctor you're
Yeah.
comfortable talking about these things with. And man, don't live with this. Don't just hide it. Don't live with this, but do something about it. And you're going to feel better. Your loved ones are going to feel better, and your life is just going to be better. So,
Yeah. Yeah, great point, man. Yeah, I totally blanked on the nitric oxide part. Like, gosh, we could have spent another 15 minutes just talking about that. So I'll
Well,
just
we're
kind
going
of
to be
throw
doing a
that out there.
second episode on this too. So,
Yeah, yeah, definitely. We'll dive in more to nitric oxide too, and like citrulline and L-arginine and all those kind of things that you can use for treatment strategies there. But we're kind of running out of time today, so I think we're gonna end it here. And yeah, just kind of signing off here. Until next time, guys. Again, be your best advocate. That's kind of the best thing I can pull from this episode is this is an uncomfortable subject. Don't worry about it. Like just you just gotta attack it, man, and go after it and be your best advocate. And if you can't
yep,
find a doctor that you feel good, working with, and just keep looking and keep looking for one that will work with you and look for those causes.
exactly. And email us at drunkenmedicine@gmail.com if you have any questions or concerns or thoughts, or feel free to comment on the podcast and we'll get to everything we can because we love just helping people. So get help.
Absolutely.
Don't ignore it.
Absolutely. Great point. All right, Mike. Great talking with you, buddy. Guys out there, thanks for tuning in. And until next time, stay healthy. Take care.
Peace out.